Friends, around 15% of the population in the world suffers from what is known as vertigo or balance disorders. Vertigo means feeling of spinning or dizzy spells. This means in India, almost 20 crore Indians will have this complaint. This makes it one of the most common complaints for visits to doctors. Today we shall see what is vertigo and how can we manage it. I am Dr. Prasad Honap, a consulting physician, and you are watching Let's Talk About Wellness. As I told you, vertigo is a sensation of feeling off balance. If you have dizzy spells, you might feel like you are spinning or that world around you is spinning and you are stationary. What causes vertigo? Vertigo is most often caused by an inner ear problem, and some of the commonest causes include what is known as benign paroxysmal positional vertigo or BPPV for short. This occurs when tiny calcium crystals, which are also known as canalites, dislodge from their normal location and collect in the inner ear in semicircular canals. The inner ear sends signals to the brain about position of head and body, and also about head and body movements relative to gravity. It helps you to keep your balance. With these loose crystals in the semicircular canals, brain receives wrong signals, and this causes feeling of dizziness or feeling of spinning, which we know as vertigo. BPPV can occur for no known reason and may be associated with age. Second common cause is what is known as Meniere's disease. This is an inner ear disorder thought to be caused by building up of fluid and changes in the pressure in the ear. It can cause vertigo, but along with vertigo, it will have ringing in the ears, which is called as tinnitus in medical language, and will also have progressive hearing loss. The third common cause is the inflammation of the vestibular nerve or inflammation of the labyrinth. This is an inner ear inflammation usually related to infection, usually viral. The infection causes inflammation of the inner ear around the nerves that are important for helping the body to sense the balance. Some of the not so common causes of vertigo are head injury or neck injury, brain stroke, certain medications which can cause inner ear damage such as antibiotics, and migrainous headaches. Vertigo is often triggered by sudden head movements, sudden changes in body position, confusing visual signals, lack of sleep, certain foods such as cheese, processed meat, chocolate, coffee, MSG, and alcohol, especially red wine and beer. Drugs such as antibiotics, commonly used drugs such as omeprazole, some analgesics, drugs used in epilepsy, and many more drugs can cause vertigo. Even stress in life can also lead to vertigo as a symptom. What are the symptoms of vertigo? People with vertigo typically describe it as a feeling like they are spinning, tilting, swaying, they are unbalanced, they are pulled to one direction. Or other symptoms that may accompany vertigo include feeling of nausea, vomiting, abnormal or jerky movements of eye called nystagmus, headaches, sweating, and ringing in the ears, and hearing loss. Symptoms can last for few minutes to few hours or even more and may come and go. Friends, we will stop this video here, and in next video we shall see when should one go to a doctor, what your doctor is likely to do, and what are the tips that will reduce the intensity of vertigo. Thank you very much.